Hello and welcome, it's Chris from Christopher Holt Training. Welcome to this week's tutorial where we're going to be talking about knee pain. So we're going to be continuing that theme and we're going to be talking particularly about pain over the kneecap. Now this is a particular type of pain, so it's going to have a particular type of treatment. So hopefully when you use this treatment, it helps with the pain, reduces it and potentially eliminates it. Before we get into it, I just quickly want to mention my social media channels, Twitter, Facebook, Instagram, and YouTube. So if you're not following, please do come along, like and follow. It'd be great to have you there. Alternatively, if you have any questions or comments about any of the content within this video, it would be great to hear from you. If you do have any questions that could expand on anything that I'm talking about, again, it'd be great to have it because it could turn into another video, more content, which I'll be able to explain a little bit more. But other than that, I will do my best to answer any questions, queries, and comments that you do put below this video. So it'd be great to hear from you, and let's get straight into the tutorial. So what we're talking about is knee pain. Now, the pain on the kneecap, it's not normally from the kneecap. So the kneecap is generally not where the problem is. Where we tend to look is the joint above and below. So if we're talking about the knee, we would tend to look at the ankle or we would tend to look at the hip, because these two joints will dictate where the knee goes. So obviously if your foot, when you walk, it hits the floor, if that's unstable or it wobbles or it doesn't hit the ground quite as it should, then that's going to offset the knee. The same with the hip. If the muscles at the top of the hip aren't functioning quite as correctly in your gait when you walk, then again that's going to affect the position of the knee. So what we're going to do in this video is we're going to focus on what's going on up in the hip, and we're going to be focusing on a particular muscle and a particular part of that muscle. So let's go through to the next slide where we can talk about that a little bit further. The specific cause we're talking about with regards to the pain over the kneecap is trigger points. So that's what we're going to be focusing on. Now, it could be something different. That's one thing I do want to make clear. But the first place I go is with the trigger points, because it's the most simple to overcome, and it's the sort of least serious injury. So if we focus on the trigger point first, and we can either say it is the trigger point and it gets better, or we work on it and it's not the trigger point because it's not getting any better, we know we then need to look at something a little bit more serious. But right now, we don't want to scare ourselves. We don't want to jump to any conclusions. We just want to start simple and just focus on the trigger point and then take it from there. So a trigger point, just quickly, is a small knot in your muscle. Now you can see down here, you've got all the little muscle fibers that are running across the muscle, but there are certain little junctions or certain little parts of it where they get a bit clogged up and stuck together, and they don't move quite correctly, and they don't flatten out into their sort of straight bands, if you will. So these are the parts of the muscle that we need to work on. Now, the muscle that we're talking about is the rectus femoris. Now, the rectus femoris is this muscle here. So it connects the start of the muscle, or the finished part of the muscle, is down here, just the other side of the kneecap. And the start of the muscle is up here on the pelvis. So it crosses two joints. So it goes all the way over the kneecap. There's the quadriceps tendon, all the way up. Belly of the muscle's there. And obviously the same on the other side. Covers the kneecap, quadriceps tendon, all the way up. And then you've got the trigger point, which is at the top here, which is this cross here. So this is the cross where the trigger point is, and this is where the pain is coming out. You may find radiating milder pain in this area, but for now we're just focusing on this trigger point and this muscle. So what we want to try and do is first work on the trigger point, which is at the top of the thigh or the bottom of the hip, and then we're going to focus on the rest of the muscle as we go through. So what we're going to do next is we're going to talk about how we can treat this trigger point. As something you can do for yourself, we're going to be talking about foam rolling. So we're going to be foam rolling the rectus femoris. Now, foam rolling, as you can see here, is this sort of foam roller that you just move. So I'm on, you can see me here, it's on the sort of middle of my thigh. So if I want to move up my thigh, I need to take my body in that direction. So I'll be foam rolling through that whole muscle. So you saw the muscle goes from, let's just say, the kneecap all the way to the pelvis. So I'm going to be foam rolling all the way from the kneecap to the pelvis. So I'm going to foam roll through that whole muscle. But what I might do is at the top here where the trigger point was, so if you remember back to the last slide, you had the cross on there. What you want to do is you want to focus a bit more of your time in this area here. So you'll just foam roll up and down in this small area for a prolonged period of time, but then through the whole of the muscle for a slightly shorter period of time. So we're foam rolling the rectus femoris. Now, we're going to be using the technique called frictions. Now, frictions, if you were to use your thumb, is where you push down on the trigger point, so on the sore area, and then you move it in little circles, so you move it around. Because what you're trying to do is break down and disperse, so you move around on these little nodules. So you're trying to break down and disperse these little nodules so they flatten out and become normal muscle fibers like these are in the middle. Now, you can do that with your thumb, as is shown on this guy's neck here, or you can do it with the foam roller, as I explained before. So the foam roller is where you would roll onto this area and then just move up and down gently on that one specific area. And then what you would do is just release and do the whole muscle. So you might do that 3 or 4 times, and then you go back to doing that one specific area. Now, once you've done foam rolling for about 1 minute to 2 minutes, then you're going to stretch. You're going to use a stretch similar to this one. Now, this is a very sort of mild way of doing it, depending on how flexible you are. But basically, you come up onto one knee, as you can see here, in this position. Now, what I've done is I've put my ankle over a foam roller. Now, depending on how flexible you are, will depend on how far your heel can come towards your bum. If you're more flexible, it will come closer to your bum. If you're less flexible, it will stay down here. But the idea is, you come into this position, and then you gravitate this knee forwards. So your hips come forward as well. And what you then do is you then want to lift your heel as far up as you feel possible, and you'll start to feel a stretch all the way through the front of this leg here. So we've massaged it through and tried to break down some of these muscle fibers and the knots within them. Then we've tried to stretch and elongate the muscle fibers so they don't go back to these tight knotted states. Now, the last thing that we need to do is then move it. So how we would move it is very simple, is we might just do a simple squatting exercise 10 times. We might do a lunging exercise 10 times. But the idea is just to try and move that muscle and give it some tension with the exercise. And what that will do is that will help the brain learn how to maintain that new position of the muscle, or that new flexible position of the muscle, because we've broken down the tissues, we've stretched it, and then we need to move it so our body can remember the new length of the muscle and the new position of the muscle. So those are 3 simple steps that you can go through to start helping overcome your pain over your kneecap. Many thanks for watching. My name is Chris from Christopher Holt Training. I'll speak to you in the next video.